Okay, so binocular vision. Why do we have two eyes? We could have this like this cute minion. We can have only single eye, but instead we have two eyes. So why? What is the virtue of having two eyes? This is to be blessed with the binocular vision. The virtue of the binocular vision. So what are the advantages and what is meant by binocular vision? Sometimes you may read in books there is what's called binocular single vision, and you got confused. How could it be binocular and how could it be single? This is mean that this is the perception of two images, an image by each eye, but still this image can be perceived as one. So although your right eye is looking to a right image, or your right eye is looking to an image which is different from the left eye, the brain can perceive these images perceived from the two eyes as a single image. So it is a binocular vision as you use your two eyes, but it is a binocular single vision because they are perceived as single image. So if we want to define the binocular vision, this is the simultaneous use of both eyes with bifoveal fixation in order to obtain a single binocular vision, or the other term is called haplopia. So haplopia meaning that it is a binocular single vision, and we now can have the advantage of having depth perception or stereopsis. So having a 3D image, or we can see the depth perception or 3D dimension, a third dimension of the objects. This is one of the main advantages of the binocular vision. So unlike the animals, the animals are their eyes, although they use their eyes, but there is no connection between the visual field of the right eye and the left eye. That's why they doesn't see binocular vision. The right eye see an image which is different from the left eye. But as humans, we can see binocular single vision due to fusion of the image between the right eye and the left eye, and this what will make us see a third dimension or see a depth perception for the objects. So what are the advantages of binocular vision? As we said, if we have binocular vision, we can see stereopsis and depth perception. If we have only single eye, we cannot see a stereopsis, or we cannot see a depth perception. So we can see the world in two dimensions only. Also, as we will say later on, the visual field of two eyes will be better than the visual field of single eye, and the visual field effects of one eye are masked. So let's say, for example, that there is a defect of the right eye here that will cause lesion or scotoma in the visual field. So this will be masked by the other eye, as the other eye will be able to see this area in the visual field. So this fusion between the binocular visual fields will be one of the advantages of having binocular single vision. Also, optical defects in one eye will be made less obvious. So does anyone have a binocular vision? So all of us or all individuals will have binocular vision even though they have two eyes. Does this mean that they have binocular vision? Actually, no, because binocular vision have some requirements. So what are the requirements? The first of all, that the two optical system of the eyes are capable of forming sharp images on the retina. So if the patient has very high anisometropia, like for example, if he has emmetropia in one eye and the -10 or -15 in the other eye, he cannot fuse these two images. He cannot see the same image in both eyes, so that he cannot have a good binocular vision. So if the two eyes must have the form sharp image, clear image on the retina. This image should be of similar size, as if these images are not similar size, this patient will have anisoconia, as we said before, and the anisoconia will prevent binocular vision. Also, these images should be the same shape. So if the patient can see square with one eye and the circle in the other eye, this will not result in binocular vision, but will result in other options that we will mention later. Also, they should be the similar color. So if we say, for example, that the patient can see a red target by one eye and the green target by the other eye, how can he see, or what will be the net result between both of them? Also, the visual pathway should be normal, and should be normal motor supply to the extraocular muscles, so that the extraocular muscles will control the eye movements. So both eyes should be moving together in normal way in order for both eyes to see the same target. Otherwise, the one eye will see a target and the other eye will see another one, leading to confusion, as we will see later on. Normal extraocular muscles, so there shouldn't be any restriction or paralysis of any of the extraocular muscles, and there so they should be good or normal nerve supply and normal muscles as well. Also, there should be one of the most important requirements for the binocular vision is that the image should fall on the corresponding retinal points. So this will be the new term here. What is meant by corresponding retinal points? Corresponding retinal points, it is a phenomenon in which there is the retinal areas in the two eyes are sharing the common visual axis. Let's say, for example, that the right eye and the left eye are looking to this target P. In this occasion, the target P will fall on the fovea of the right eye and fall in the fovea of the left eye. So the visual axis which will pass through the fovea and the nodal point and the target will be in the same location on the space, or if we extend this visual axis, it will project into the same area in the space as we project the visual axis of the other eye. So it will pass through the fovea and the nodal point and the same target. In this occasion, this means that the fovea of the right eye and the fovea of the left eye are corresponding retinal points because they will project to the same area in the visual space. They share the common visual direction. And also because the fovea of the right eye and the fovea of the left eye will be connected to the same area in the visual cortex. And here is the importance of the retinal correspondence. So the retinal correspondence, meaning that not only that the fovea of the right eye and the fovea of the left eye can see the same target at the same time, but they will project to the same area in the visual cortex, so that the right eye will report an image in the same in a specific area in the visual cortex, that the same, and the left eye will report a different aspect of this image to the same area in the visual cortex, so that the both eyes can see this image as a single image. So here again, this is another example. You can see this is the fovea. Seeing this while they are fixing. In this occasion, while the fovea, or there is bifoveal fixation over this target, a point on the right nasal retina can see this red square, while a point on the left nasal retina can see the same red square. So this point on the temporal right retina is a corresponding retinal point to this point on the left nasal retina. The same thing with this blue triangle. The blue triangle will be falling on a point in the nasal retina of the right eye that will be corresponding with another point on the temporal retina of the left eye. So this point and this point are called the corresponding retinal points. These points are seeing the same target and will project to the same area in the visual cortex, so that they can see this target as a single target. So that is what meant by this is a requirement for the binocular single vision. So although that the target is falling on two different areas in the right eye and the left eye, but since they are corresponding, then they will project to the same area in the visual cortex and will be perceived as single. So here we have term what is meant by normal retinal correspondence and abnormal retinal correspondence. The normal retinal correspondence when the retinal areas have identical relationship with the fovea. So for example, if the both eyes are looking to this tree and this is the fovea itself can be called corresponding retinal points. If there is a point or if this tree is perceived by a point on the temporal retina of the right eye and the nasal, let's say for example that there is a flower here. This flower can be perceived by a point on the nasal retina of the left eye and the point of the temporal retina of the right eye. If these points are having the same relation to the fovea or having the same distance from the fovea, then these are called normal retinal correspondence. As you can see here, so these are called, or this candle are falling on a point on the nasal retina of the right eye and the point on the temporal retina of the left eye, so this is called a corresponding retinal point. But abnormal retinal correspondence, meaning that when these points don't share the relationship with the fovea. For example, if this eye has some exotropia or they are deviated outward, so that the fovea, like here, and this tree falls on the fovea of the right eye, sorry, of the left eye, but it doesn't fall on the fovea of the right eye. So the fovea and this point is called now non-corresponding retinal points. And this non-correspondence occurs due to this deviation of the eye. That's why we said that the normal ocular alignment is a prerequisite for binocular vision. So corresponding retinal points are points on the retina from which the images are projected to the same place in the common visual field. These images of an object must fall upon these points to be seen single. So what happens if the image fall on the non-corresponding retinal points? This will result in diplopia or seeing a double vision because these points are now called disparate. Disparate or disparate retinal points, meaning that it is non-corresponding retinal points. Again, disparate retinal points are non-corresponding retinal points. So if the image fall on non-corresponding retinal points, this can result in diplopia unless there is what's called some sensory adaptation, as we will mention in a while. The binocular field or the binocular field around us can be divided into three regions. So as you can look forward, you will the objects present in the surrounding visual field around you, they can be divided visually into three areas. The first one is called the horopter. The second one is called the Panam's area. The third one is called the area or the region outside the Panam's area. It is very, very important to know what are the characters of each one of these regions. You need to know what are the characters of images present or perceived through any if they are falling on any one of these regions. So images are present in the horopter are seen single with no depth perception. Images seen on the Panam's area are single but with depth perception. Images seen outside Panam's are seeing double as due to physiological diplopia but have depth perception or stereoscopic vision. Let's see let's analyze these areas in much more details. So what is the horopter? Horopter is a Latin word for the horizon of vision. So if you are looking to a point of fixation, let's say, for example, this is the fovea and this is the fovea, and this is the point of fixation, which is the red circle. The horopter meaning that a line that connect the all points in the space, that these points will be the site of projection of corresponding retinal points. Meaning that if the B and B dash are corresponding retinal points, they would project into the space into this green circle. If A and A dash are corresponding retinal points, they will project into the space by this bluish square. So if we add all corresponding retinal points together and make a line that will connect all the site of projection of corresponding retinal points, this line now will be called the horopter. So it is a curve in the space that connects a set of points from which light falls on the corresponding retinal points on both retinae. So if the individual is looking to forward and he is now fixing to a target, now his right retina and left retina will share common visual axis to different points in this space. These points, when connected together, will form what's called the horopter. So the horopter, it's like a curve, as you can see here, formed by corresponding retinal points of the both eyes. If we continue the horopter, or if we continue this circle of the horopter, so this will pass through the point of fixation and the nodal point of the right eye and the left eye. In this case, this is called the Weissmuller ring or the Weissmuller circle. So the Weissmuller circle, it is just the extension of the horopter. Just the extension of the circle that will pass through the fixation point and the sites of projection of different corresponding retinal points of the right eye and the left eye, and also will pass through the nodal point of the right eye and left eye. So here we come to the thing. What are the characters of image? Or before we call the characters of image, let's say what are if we are looking to somewhere in front or behind the horopter, what will be the characters of the image? So if the eyes is looking to the point of fixation here, so this is the horopter of this eyes at this particular position. What happens if we look or at this time? What happens to objects present in front of this point of fixation? And what happens to the objects present behind this points of fixation? This will result in what's called physiological diplopia. As these points, now you can see that these points in front and these points behind are not falling on the corresponding retinal points, because points or corresponding retinal points already form the horopter. So if any line or any object in front or any object behind will not fall on the corresponding retinal points, so that the right eye will see an image which is different from the left eye, and this will result in diplopia. So let's now just say what are the characters of the objects seen at the horopter. Let's say for example that this woman is sitting on this chair and focus on Ralph. So Ralph here is falling on her on fovea of both eyes. So these are called corresponding retinal points. And also Susan will be falling on a corresponding retinal points in the temporal retina of one eye and the nasal retina of the other eye. And same as Harry. So both Harry and Ralph and Susan will be falling on corresponding retinal points of both eyes. That's why this what will make the horopter. Carol and Charlie are now before the horopter, and if there is anyone here, this will be behind the horopter. So this person and Carol and Charlie will not fall on the horopter, and they will fall on other areas that we will mention later. So what are the characters of images seen in the horopter? So what are the character of Susan and Ralph and Harry? Since they are falling on the corresponding retinal points, so the retinal disparity equals 0. So again, they are falling on corresponding retinal points. There is no disparity in the retina. And they will be seen single, because again, they are falling on the corresponding retinal points. But the only problem here, that since they are falling on the corresponding retinal points, there is no stereopsis. Why? Because the stereopsis, or to see a third dimension of an object, this must be in order to see a third dimension of an object, we have to see different views of the same object, meaning that the objects should be slightly dissimilar. Again, the objects should be slightly dissimilar, and since we have zero disparity, so the object here is falling on the retina of both eyes, so they are completely similar. They are completely identical. We see the same image of the right eye and the left eye. So we cannot appreciate a third dimension for this person. So the drawback or the only drawback of the horopter, that if in an image present or an object present in the horopter, it will fall in completely identical corresponding retinal points. So the image will be completely identical in both eyes. So there will be no depth perception. We mentioned something about diplopia. So we said that the images present in the horopter will be seen single. So what about the images seen behind or in front of the horopter? If the subject is fixed on the space like here, then the objects present in front or behind will not fall on the corresponding retinal points, as we agreed. This will lead to a diplopia called physiological diplopia. This diplopia is either crossed or uncrossed. Crossed meaning that the image here will make two images. The right eye will see the left image, while the left eye will see the right image. So the crossed diplopia is for the nearer targets, while uncrossed diplopia is a diplopia also. So we will see two images, and these two images, the right eye will see the right image, and the left eye will see the left image. So this is called uncrossed diplopia. So again, if the patient is fixing on the object here, so this is the horopter, and this is the Weissmuller circle. And now, during fixation on this object, objects present behind this object are seen double, but this is cross diplopia. So the right eye will see the left object, and the left eye will see the right object. While during fixation, if there is an object away from the horopter, then this object will be seen again double, but the right eye will see the right eye will see the right object, and the left eye will see the left object. So if you want to test this, you can easily try this at home. So if there is put two targets in front of each other, like for example, like a pencil and the tree, and while you are looking to the tree, you will find that the pencil picture become hazy or become blurred and become double, and vice versa. If you are looking at the pencil, you will find that the tree behind will become hazy and become double. So why, if this normally occur, if we have normal physiological, it's called physiological diplopia, and this should happen in our daily life. So why don't we appreciate this? Why, as we go to work or go to the college or go to the or go to the club, we don't see the double images as we go? This is because the brain has been accustomed or to suppress this diplopia. So the physiological diplopia, as you are looking to a target, the brain is doing its job. It is suppressing the diplopia of images in front of it and behind of it. So the physiological diplopia is suppressed in the everyday life, but they are not suppressed only in the normal situation, but can also be suppressed in children who have squint. So children who have a squint, this squint doesn't lead to diplopia. This is because of abnormal retinal correspondence. So the retina, the retinal element of squinting eye assume an abnormal relationship with the fovea of the straight eye. So if the child when he is young, and if he has one eye is deviating, then the fovea of the normal eye will make abnormal relationship with another area or extra foveal location of the other eye. So this will result in abnormal retinal correspondence, And this the fovea of the normal eye and the abnormal area in the other deviating eye will project to the same area in the visual cortex. So now the child has no problem, or that the child can see with his both eyes, but with abnormal retinal correspondence. He of course has a problem, but he can compensate for this diplopia by having abnormal retinal correspondence. So we will talk about this as we will mention the sensory adaptation. So to summarize, when we have two images fall on the two corresponding areas of the retina, the identical images are fused, like that of present at the horopter. Slight difference can be tolerated, so we don't have to see completely similar images or completely identical images, because the brain has the capacity to fuse the slight difference between both images. And guess what? This slight difference is important, and it is necessary for depth perception, because as I mentioned, the completely similar or completely identical images will not form any sensation of depth. So this disparity, as long as it is small, it can be utilized by the nervous system to build a depth difference among different objects. So if we are the fixation point at the horopter, which has zero disparity, then there will be no disparity, and there will be no difference in the depth, and we cannot see a third dimension. But if there is mild disparity between the images perceived by both eyes, so if they are falling on a slightly non-corresponding retinal points, this will lead to some depth perception. Let's see what is the application of this. It is called the Panam's area. So if you just listen to the previous part, you will assume that the areas in front of the Panam, in front of the horopter and behind the horopter will be seen double, because they are falling on the non-corresponding retinal points. So is this true? The answer is false. The first part of the sentence is true, that in front of horopter and behind the horopter, the areas are falling on the non-corresponding retinal points. But the second part of the sentence is not true, because they will not be seen double. They will be still seen single, because they will be fall in the Panam's area. So the Panam's area, it is the area in front and behind the horopter, and in which the points can be still seen single. So how does this occur? They are falling on non-corresponding retinal points. This has two theories. The first one, that a point on one retina has many corresponding points in the other retina. So if there is an eye, and then this is an eye, and the area or an object present in the space projected to the fovea of the other eye, the fovea of one eye is not only corresponding to the fovea of the other eye, but it's corresponding to some parafoveal areas or parafoveal points. So that if the object is in front or behind the horopter, and fall on non-corresponding retinal points, so it will fall on the fovea of one eye and extra fovea to the other eye, they are still can be seen single, although they are non-corresponding retinal points. The second theory, that the Panam's area correspond to cortical units rather than the retinal points, meaning that if the fovea of one eye and this slightly displaced area or the parafoveal region in the other eye will both project to the same area in the brain. So they will both go to the same area of the visual cortex, so that the corresponding is for the Panam's area is not at the level of the retina, but it is at the level of the cerebral cortex. So as long as they fall on the same area in the visual cortex, it doesn't matter if they fall on the same areas on the retina, because they will still be perceived as a single image. So what is the limits of the Panam's diffusional area? So the Panam's diffusional area is an area in front and behind the horopter. This area is the most narrow in the center and most wide in the periphery. So the Panam's, that's why it's called the Panam's diffusional area. The range of the disparity within which the single vision is still preserved is called the Panam's diffusional area. So if we place any object present in this location or in the Panam's diffusional area, although they are projecting to different areas within the retina or non-corresponding retinal points in the retina, but they can still be seen single, and this is the advantage of the Panam's diffusional area. So the brain can still fuse the image of these two eyes. So what are the characters of objects seen at the Panam's diffusional area? They have retinal disparity. They are falling on the non-corresponding retinal points, but they can still be seen single. And since they stimulate slightly dissimilar retinal points or they show some retinal non-correspondence, this images present in this area will be seen with depth perception. So if there is an image here and the image here or image here or image here, they will be seen within the Panam's diffusional area. They will fall on the non-corresponding retinal points, but they can be seen single. And since they are slightly dissimilar because they fall on non-similar retinal points, so the brain will perceive a slightly dissimilar or a slightly different image in the right eye and the left eye. The brain will be able to fuse this image and perceive depth perception. So the images present in this location will be seen with a 3D dimension or with stereopsis. So what happens to this is the horopter and this is the Panam's diffusional area. So what happens to target seen outside Panam's diffusional area? If we are more in front or more back or more in front. This is called the area outside the Panam's area, like here and here. So they will fall on the non-corresponding retinal points, but they will undergo physiological diplopia because the retina now or the non-corresponding retinal points are very dissimilar or very different. They are either very close to the eye or very away from the eye. So they are not falling on the corresponding retinal points and they are not slightly dissimilar. They are totally different. So that this object present outside or inside will undergo the physiological diplopia, but here it is the advantage that it will undergo stereopsis. So stereopsis meaning that the image will be falling on the non-corresponding retinal points. Although it is dissimilar, but it is still can be seen with the stereopsis because they are falling on the non-corresponding retinal points. They will not perceived as single image, but will perceived as double, but again because they are falling on the non-corresponding retinal points. So the secret word here is the retinal correspondence or the retinal disparity. If they are totally corresponding retinal points, like in horopter, to summarize, if the horopter here is the horopter, this is the bi-smaller circle, and this is the point of fixation. So this is called the horopter or the empirical horopter. So if any image present in the horopter, this image now will be seen single, as the retina is totally corresponding, but with no depth perception. But if there is an area or image present in front or behind within the Panam's diffusional area, this image will be falling on the non-corresponding retinal point, but still can be seen single with stereopsis. Areas in front of or outside the Panam's diffusional area, like here or there, they will be falling on the non-corresponding retinal point, and there will be will show diplopia and stereopsis. So to make them more clear, I made this or this illustration will make this concept much more clear to you. So the eyes now can see this apple falling on the both eyes and can be seen single because this is the point of fixation and this is called the horopter. This horopter is not a fixed line. This horopter can change as the eyes are moving, either looking to the distant target or looking to the near target. The horopter will change. So the cross disparity, meaning that if there is an area before the horopter or lying outside the param diffusion area close to the eye, then they will cause cross disparity. So they will be seen double. So the right eye and the left eye will see the apple, but they are perceived on the corresponding retinal points. That's why the apple can be seen single, but the flower is seen on the two eyes as falling on the non-corresponding retinal points. That's why they will be seen double. So the right eye, in the right eye, will be seeing the object on the left, while the left eye will see the object on the right. The uncrossed parity when the object is away from the point of fixation, they will be seen double, but the right eye will see the object on the right, and the left eye will be seeing the object on the left. In the Panam's diffusional area, so there is the physiological diplopia, the crossed, and physiological diplopia, which is the uncrossed. The Panam's diffusional area, it's the area in which from the eye than the flower, which is the same like here. And this what will you see? You can appreciate now depth perception because that this flower present in the Panam's diffusional area will fall on the non-corresponding retinal points, and this will give the rise to the stereopsis. Also, the area outside the Panam's diffusional area will be seen with stereopsis, so you can appreciate the depth perception. But since it will undergo diplopia, the brain will suppress this image, will suppress the diplopic image. So you will see that there is an image which is in front of the apple, and this image is diplopic. But the brain, as you are looking to the apple, you will find that this image, which is diplopic or double image, will be suppressed as the brain is used to suppress the physiological diplopia. So is everything clear up to now? Can't you see? Hello? Can you see the screen? Does anyone have a problem with the screen or with the voice? Since how long can't you see the screen? Can you see the screen now? Okay, let me restart the connection. Can you see the screen now? Okay. So we will continue. Did you see this slide before, or it is the first time? Okay, so we'll start from it. Again, to illustrate what are the differences between the horopter and the panoms and the panoms diffusional area. So here are the horopter, and here the horopter is changing, so you can see it in front of the eye, whether they are looking to the far target or to the near target. It is changing all the time. And the cross disparity, if we are present a target in front of the eyes, then they will undergo physiological diplopia, and the physiological diplopia this is cross diplopia, so the right eye will see the left image and the left eye will see the right image. If you are looking toward the distant target or the apple and any object behind or in front of the apple or away from the apple, this will undergo again physiological diplopia, but this is called the uncrossed diplopia. So the right eye will see the right image and the left eye will see the left image. The Panam's fusional areas or any target present within the Panam's fusional area will be seen single, although it will stimulate non-corresponding retinal points. As you can see that the flower here is close to the fovea, but the flower here is away from the fovea, but they are still can be seen single, and with depth perception. So what we can see is that the apple is much more away from the flower. So the sense of this depth was due to that the flower is present in the Panam's fusional area. And also it is also, as we said, the areas behind and the areas before will be the areas outside Panam's fusional area, which will be the image falling on them will undergo physiological diplopia, which will be suppressed. So if there is a flower here, this flower should undergo physiological diplopia, as it will fall on the non-corresponding retinal points and it lies outside the Panam's fusional area, but the brain is used to suppress these images in order to see the apple clearly. So do you have any question in this last part? Okay, so what happens if the two eyes are misaligned? Like, for example, if there is infantile strabismus, or if the child has squint, and this child has his two eyes are not aligned together, or the eyes are not orthophoric. So this child will, in order to compensate for this ocular misalignment, he will undergo what's called a sensory adaptation. So the child has a motor problem, and he is trying to correct it by a sensory mechanism. So how the problem or the motor problem is that the image seen by the right eye is different from the image seen by the left eye, or the image perceived by the right eye will fall on the non-corresponding retinal point to the left eye. So this will leading to diplopia. So the object of fixation will fall on the non-corresponding retinal points. This will lead to diplopia. So how to overcome this diplopia, we will see later on. While the fovea of the fixating eye is directed toward the object of fixation, the other eye will be looking to a completely different object. If both images perceived, this will lead to confusion. So here is the problem. Here is a child who has his both eyes are misaligned together. He will see diplopia. He will see double vision, because at the moment one image is perceived by the other eye, by one eye, another object is perceived by the other eye. So he will undergo either confusion or diplopia. So in order to overcome this diplopia or confusion, this is overcome by mechanisms of sensory adaptation. This occurs in children because the children have what's called visual plasticity. So their visual system is still learning and it is still evolving, and it is still, it didn't maturate enough. So they can be plastic, or they can reform itself in order to overcome this motor problem. This can be done by two mechanisms. One of them is called suppression, and the other is abnormal retinal correspondence. So suppression meaning that the brain can suppress the image which is coming from the less sharp image from the deviated eye. And the abnormal retinal correspondence mean that the brain can assume an abnormal relationship between the fovea of the normal eye and an extra foveal location of the other eye, so that the image cannot be seen double, and to overcome the confusion. So the suppression meaning that active inhibition of the vision of one eye. So it is active, but it is involuntarily. So the patient cannot control it. But the brain do this job, or the brain does this job in order to avoid the diplopia and confusion. So the brain cut the visual impulses that is received from one eye. And this can be either total, so it will be the whole retinal function. So this can be further subdivided into selective suppression, such as central, so the brain will suppress the central image, or peripheral, suppress the peripheral image, or even the brain can selectively suppress a specific function like the resolution or the visual acuity or even the color sense. But this is not very common. Actually, the most common is the total extension or total suppression of the whole retinal function. Or it can be facultative suppression. Facultative suppression meaning that it is alternating. If both eyes have more or less similar visual acuity, then the brain can suppress each eye at a time. So when one eye is deviating, this eye could be suppressed. Then the other eye is deviating, so the other eye is suppressed, and there will be alternate suppression between both eyes. So this indicates that both eyes have good visual acuity. Or it can be obligatory suppression or amblyopia. So amblyopia meaning that the child is not the brain didn't or doesn't receive an image from this affected eye because this image is not sharp enough or not clear. So in order to avoid the confusion, this eye will undergo the brain will shut down the visual impulses perceived from this eye. So although in this condition, this doesn't have to be a misalignment of the eyes. So both eyes could be aligned, but let's say, for example, one eye has total cataract, and the other eye has normal vision. So the brain will shut down the images perceived from this eye which has cataract. This is called amblyopia or sensory deprivation amblyopia, one type of amblyopia. So this was some mechanisms, or the suppression is a mechanism in which the eye suppress the image from one eye in order to avoid diplopia or confusion. The other mechanism is called the abnormal retinal correspondence. In abnormal retinal correspondence, the binocular condition in which the fovea of one eye, which is the fixing eye, correspond to a point other than the fovea of the other eye, which is the deviating eye. So the fovea of one eye has a common visual axis or common visual direction with the extra foveal location of the other eye. So if this eye is deviated inward, then and this is the fovea of each one. In order, the fovea of the right eye will see an image different from the fovea of the left eye. So what do these eyes can do? The brain can suppress the image perceived from the fovea in order to avoid diplopia. So let's say, for example, that the fovea here can see a car. So at each time, the right eye will see the tree, the left eye will see the car. So this will lead to confusion as the brain will not be able to fuse the image of the car to the image of the tree. So the brain can suppress the image of the fovea as the image of the car or suppress the fovea, so no image is perceived from the fovea, or and can do what's called abnormal retinal correspondence. This area in the nasal retina of the left eye will assume an abnormal relationship with the fovea of the right eye. So the fovea of the right eye and this point in the nasal retina of the left eye are now called corresponding retinal points. But these corresponding retinal points are abnormal. This is not normal because they are not making the same relationship with the fovea. So this abnormal retinal correspondence exists only during the binocular vision. So if the fixating eye is covered, the visual direction of the deviating eye immediately return to normal. So in this occasion, if we covered if there is abnormal retinal correspondence with no suppression, if we covered the right eye here, put a cover on the right eye, then this left eye will again fix with the fovea on this tree. Because if there is no suppression, then this left eye will fix on the tree if we cover the normal eye. But if there is suppression of the fovea and this area is now becoming the new fovea, or the brain is assuming or making a new fovea of its own, then this is called eccentric fixation. So if the resistance of the abnormal visual direction during monoocular vision, this is called eccentric fixation. Again, if we fix the right eye and the brain has only abnormal retinal correspondence of the left eye, so but there is no suppression, the left eye will undergo fixation. So the left eye will see this object by the fovea, as abnormal retinal correspondence is only under binocular vision. As abnormal retinal correspondence is binocular process. But if continuous abnormal retinal correspondence occur until the brain didn't recognize any image coming from the fovea, so the fovea is now not used for fixation, and we cover the right eye, we will still see that the patient eye, the left eye, is deviated. This means that the left eye has developed what's called eccentric fixation. So a patient who have abnormal retinal correspondence can looks like the normal. He can see a single image with no diplopia. But if he can see the single image with no diplopia, but the eye is deviated, he may also have an abnormal retinal an eccentric fixation. We will need this later on. So how to test for the binocular vision? Binocular vision have many tests. There was an old test used, or an old device. It is was all. I didn't even think that I have seen this device anywhere, or it is not used in the modern practice. It's called the Synaptophore. Synaptophore is a device that is used to project an image to the right eye that is different than the left eye, and then the patient can approximate these arms together in order to see these images, to fuse these images, and the patient will be asked which image he can see, and the patient will see the results of this test later on. The Pagolini striated lenses are a pair of polarized glasses. So they are polarized. When we project a line, one eye will be the lines will, or the glass will be projected in the horizontal direction, and the other will be, sorry, there will be made, the striations or the polarization will be made perpendicular to each other, so that when they are looking to this point of light, they will see that this light is made two crossed lines, or making a cross. If they can see the both cross together at the same time, then they could be normal, or even they can be having abnormal retinal correspondence, as we agreed. So this patient can be normal, seeing by both fovea of his both eyes, or he can make, or he has also a possibility that he makes an abnormal relation between the fovea of one eye and extra fovea location of the other eye. If he can't see across and the two lines are separated, so the right eye is separated from the left eye, then this means that the right eye can see an image different from that of the left eye. So this means that the patient has diplopia. If the patient cannot see one arm and see only one arm, like see for the left eye only, then he has right eye suppression. So the brain suppressed the function or suppressed the image coming from the right eye in order to avoid confusion or diplopia. Another test called Pilchovsky or Piskovsky. This test in which the same, this will be the same issue or the same thing like the Pagolini striated lenses, but in this case the patient is viewed filaments of light. One will be vertical filament of light and for the left eye, and the right eye will see a horizontal filament of light. If the left eye should see the vertical one and the right eye will show the horizontal one in the same time, so this should be a normal retinal correspondence. In this occasion, if the patient can use his both fovea of the same time, this can mean that he has normal retinal correspondence. But if he can see both of them, but the central hole is not coinciding in both of them, this means that the patient used a fovea of one eye and an extra foveal location of the other eye, so this is an abnormal retinal correspondence. Again, this can be of the right eye or of the left eye. Again, can be abnormal retinal correspondence. So he cannot see the two cross, the previous one, since we have a cross, so the patient will be able to see the cross. But in here, since the cross is not complete from the middle, the patient can see that if the cross is away from each other, or the vertical and the horizontal light are away from each other, this means that the patient is not seeing by the fovea of one of the two eyes. The most commonly used is called the Worth-Fordot test. This is a test, not. So what is the test? This is one of the dissociative eye tests, meaning that we make the right eye see an image that is different from the left eye. So we project red dots in front of the patients, one red, two green, and one white. And the patient wear red-green goggles, so the red goggles will be made in front of the right eye, and the green goggles will be present in front of the left eye. And then we will ask the patient to interpret what is the result. Normally, if the patient has good or normal binocular single vision, the red eye will be able to see the red circle, and the green eye will be able to see the green circles, and the white circle will be seen in a middle color, or in between color between the red and the green. So he can see that the whitish circle is appearing reddish green or greenish red, something or some color in between. So this means that this patient has a binocular vision. If he can see the red circle only and the white circle can be seen as red, this means that his left eye is suppressed. So the patient has uniocular vision only with the right eye or has left suppression. If the patient can see the two circles of the green and the whitish circle can be seen with the green color, this means that the patient can see only with his left eye and the right eye is suppressed. So there is a right suppression. If the patient can see alternating vision, meaning that he can see first report that he can see 3 circles, then 2 red circles, then 3 red circles, then 2 red circles. This means that the brain alternate the vision between both eyes. So he may have a facultative suppression. So the brain suppress each eye at a time, and this means that the patient has good vision in both eyes. But if the patient can see 5 circles, then this patient has diplopia, because the red eye or the right eye can see the red ring or the red circle, and the white circle can be seen as red, and the green eye or the left eye can see the 2 green circles and also see the red or the white circle as green. So why didn't the patient fuse the white circle between the red and the green? This is because the right eye and left eye are not well aligned. This patient could have a paralytic squint, for example. In this occasion, the right eye seen the white circle separately than the green eye. So the red eye seen the white circle with the red color, and the green or the left eye seen the white circle with the green color, and it didn't fuse these colors together because they are not well aligned. Like this is, for example, this is the eye like this, and the eye is like this. So if there is a 5 colors, then this is a paralytic squint. If the patient has a manifest squint, then and can see that the red color and the 2 green and the one is reddish green, this could have an abnormal retinal correspondence. So not every patient or not every individual who can see the red and the 2 green or green and 1 reddish green is normal, because he may assume an abnormal relationship between the fovea of one eye and an abnormal and another extra foveal location of the other eye. So this patient could have an abnormal retinal correspondence, and hence he will perceive this whitish ring as or whitish circle as reddish green. I hope that this video will be working. So this is
used to identify the type of the deviation by determining the type of diplopia, and it can also indicate suppression. Note that usually the test is performed under dim condition, but due to the circumstance, the light will be on.
So here is an example for the Worth-Ford test.
Distance, which is 6 meters, but there is also a near form which uses a Worth-Ford light pen torch.
Okay, now I want you to put this last one. I want you to put red on the right and green on the left.
So the patient now is wearing the red-green goggles with the red in front of the right and the left green in front of the left eye.
Tell me what you see. How many lights do you see?
I see 5 lights. The patient sees 5 lights in the...
Here is the patient seeing the 5 lights.
The green lights are on my right side and the red on my left. Yeah. This suggests that the patient has cross diplopia.
How far apart are the 2 lights?
They're pretty close to each other. This indicates that the deviation is small.
Is there any light between the 2 lights? Example, is the red light, set of lights higher than the green?
So the patient here can see 5 lights, and this means that the patient has diplopia.
This suggests that the patient has no vertical deviation.
Okay, thank you.
You may be asking in the exam about the use of red-green glasses. We have mentioned some of them, so let's summarize them again. The Worth-Ford test can use the red-green goggles. We will say about another test today. It's called the TNO test. This is test used for stereopsis, used for the red-green goggles. The red-green glasses can be used as Maddox rod. So the red-green Maddox can be used to test for the torsional diplopia or for the cyclotorsion by placing the Maddox rod of red in front of right eye and green in front of the left eye. Also, red-green goggles can be used for a quantitative test for the angle of squint or angle of deviation in case of a squint. This test is called the Hess test. Now let's talk about the grades of binocular vision. The binocular vision is not similar in all individuals, or it has some grades. So it can be mild, or it has mild grade, or moderate, or the advanced grade. So the first grade of binocular vision is called the simultaneous macular perception. This means that both eyes can perceive an image at the same time. The second grade is fusion. So the brain is able to given by the 2 eyes. The third grade is called stereopsis, that after receiving the same images from both eyes, and the brain is fusing it, now we can appreciate depth perception. So there is no stereopsis without fusion or simultaneous macular perception, and there is no fusion without simultaneous macular perception. Each grade is dependent on the previous one. So what is the simultaneous macular perception? It is as simple as that the brain can perceive two images at the same time, not from each eye of the same time. So this is not doesn't mean that the eyes have a very good visual acuity, or this doesn't mean that these images are identical, or that they are fall exactly on the same point, or that they are fused, so they are seen single. But this is the just most elementary type of the binocular vision. This doesn't mean more than its name, that both macula or both eyes can see images at the same time. So it is a simultaneous awareness of the similar but not antagonistic targets. So one foveal and one extrafoveal, meaning that to test this type of binocular vision, we need to present a target that are not antagonistic but slightly dissimilar. So we like the famous example is the bird and the cage, as we will see now. So this type of binocular vision is formed at the 6 months after birth because it is very basic form of the binocular vision. So in this case, if the patient has binocular vision, we can present a bird and a cage or an animal with the cage, and in this condition, these images are dissimilar. They are not dissimilar. They are not the same thing, but they are not antagonistic. So this is not a cat and a flower, for example, but this cat is, or this dog is within the boundaries of this house. So if the child has a simultaneous macular perception, he will be able to perceive that this dog is present at this house. So this doesn't mean that the brain is fusing something, but this means that only that we can see that the dog and this house are seen at the same time. The fusion is more advanced level of the binocular vision, which is reflect the neural processing of the images perceived by both eyes. So when each eye receive an image, then these images now are double, or the right eye receive an image, and the left eye receives another image, and then the fusion, which will allow these two images to be perceived as single image. This this processing is the ability to see the single vision from the both eyes. So it is the ability of the both eyes to form a composite picture. So this picture is formed but has two elements, one from the right eye and the other from the left eye, and yet they can still be perceived as a single image. So in order to test this, we can make a test in which there is two images. Each image is missing a single detail, and ask the patient if he can see that can see the full picture. Like for example, the rabbit and the tail example. So the patient is present a rabbit that has a tail but missing a bouquet of flowers. And there is another rabbit which has a bouquet of flowers and there is no tail. So what does the patient see now? If he can see a rabbit that has a bouquet of flower and the tail, then he was able to fuse the both images together. So this is another advanced form of the binocular vision. And this will also reflect what's called the fusional vergence. So what is the fusional vergence? So fusional vergence is the movement of both eyes that will enable the fusion of monocular images to produce binocular vision. Meaning that if the eye is here and the other eye is here, so if we present a very near target, this target will be called, if we are looking far, then this target will fall under the physiological diplopia. So if we have a target like here and we approximate toward the eye, both eyes will converge. So these eyes will converge until with further convergence, the image is seen double. So try to approximate your finger toward your eyes now, and you will find that you will converge and converge and converge until your finger is seen double. So how much did you converge is called the fusional vergence. This is just the movement of your both eyes that will enable this this monocular image of this one object to be seen to produce binocular vision in both eyes. This fusional vergence is different for convergence and divergence and vertical and cyclodeviation. It is the most abundant in the convergence. So the eyes can converge to about 15 prism diopter for far target and about 25 prism diopter for near target before the target can seen double. And if we place the target for far, the eye will theoretically can diverge in order to see the far target without diplopia for 6 prism diopter for far and 12 prism diopter for near. The ranges for the vertical and the cyclodeviation are much lower. So for the vertical deviation, if we present, here is one eye and here is the other eye, and we present a target like here and there. So how much does the right eye can elevate and the left eye can depress in order to see this star as a single star? This is very limited, as it's about 2 to 3 prism diopter for the vertical and even for the cyclodeviation. So how much the right eye can intort and the other eye can extort, it will be around 2 to 3 degrees. So the amount of fusional vergence for the horizontal, like convergence and divergence, is much more than the vertical and cyclodeviation. That's why if I present to you this image of this finger, you can tolerate it or you can compensate for it. You are not feeling much annoyed because you have a good fusional vergence for horizontal. But what happens if I present you this picture? Well, this picture is much more annoying because you have now vertical diplopia. Your eyes are trying to look up and down to fuse this vertically dissociated image of the eyes and nose and mouth, and you have a limited range of the vertical fusion. So the fusion, or when the object is present in front of both eyes, when they are different, the eyes can do different mechanisms in order to compensate for this discrepancy between the images. This can be either suppression, or superimposition, or binocular or retinal rivalry. So what is meant by this? We have just said the suppression. Suppression is just if we, in order for the brain to fuse the images, and if the brain cannot fuse the images because they are very dissimilar and very different, it will just take the easy solution and eliminate one image to prevent confusion. The other thing, or the other element, or the other mechanism of fusion is called the superimposition, which is result in one image presented over the other image. And this is more common with the colors. For example, if I present to you a red color in one eye and like a blue color in the other eye, so the brain or the eyes can fuse both colors to see an intermediate color in between, like for example, like the magenta. So the fusion of colors occurs by superimposition. Or the binocular rivalry. Binocular rivalry meaning that there will be an alternating suppression of the two eyes, resulting in alternating perception of the two images. So the eyes will see each image at one time. So this is like the facultative suppression, something like the facultative suppression. So for example, let's say for example that the right eye can see this red circle, and the left eye is seeing this square. So this eye is now these points are corresponding retinal points, and now the circle or the corresponding retinal points of one eye is see the red circle, but the other corresponding retinal point in the left eye is seeing this green square. So what happens? Since this is the deviated eye, so it will see a blurred image, so the brain just block the visual impulse come from the left eye. So what can he see? He can see only a red circle because the left eye is undergoing suppression. So this is the suppression. The superimposition meaning that it will superimpose the two images over each other. So the right eye see the circle, the left eye see the square. So the brain superimpose the two images together, and this will lead to confusion. This mostly will lead to confusion, but it can be used, or it cannot lead to confusion if in infusion of some objects like colors, as I told you. Retinal rivalry is when the both eyes have similar visual acuity or closely similar visual acuity, so each eye can be used at a time. So the right eye can see sometimes the red circle, then the brain shot the image from the right eye and use the left eye that can see the green square, and then shot the image of the left eye, then see again from the right eye. So there will be alternating vision between the image perceived by the right eye and the image perceived by the left eye. The fusion itself is a function of a higher level, so it is present at the cerebral cortex. So since both eyes will send their images from the corresponding retinal points, they will be end at the area 17 in the occipital cortex, which will fuse these targets. So that the fusion is not a function of the retina. The retina is just to receive the image, but to process the image is a function of the cerebral cortex. And then from area 17, it will project some fibers to area 18 that will respond only to binocular stimulation. And also area 18 has some center that will respond to only to if there is a stimulation of slightly dissimilar objects for the function of stereopsis that we will talk about now. So the fusion, to fuse the field that is seen by the right eye and the left eye, this is to perceive them, it is just the function of the retina. But to fuse them, this is the function of the visual cortex. So the right cortex can see the left field and the right cortex can see the right field. Fusion of these fields in order to see a complete picture, then this will be the function of the area 17 or the visual cortex, and also it has some connections to area 18. Finally, we reach the highest grade of binocular vision, which is the stereopsis. So stereopsis meaning that our eyes are not straight aligned like this, because if they are straight aligned and we can see these two dogs in front of each other, we will not be able to see which one is in front of the other one. It is the bluish one or this beige one. But actually our eyes are laterally displaced in the orbit, so that the right eye will see a different view of this image than the left one. So the right eye will see this view, while the left one will see this view. So by combining these images together in the brain will understand that the white dog is in front and this beige dog is behind. So it is the lateral displacement of the eyes that will provide two slightly different views of the same object or disparate images and allow stereoscopic depth discrimination. So stereoscopic vision arises from the fact that the two retinal images are not exactly the same. That the right eye receives a slanted view of an object and the left eye will receive another slanted view, so that these images are slightly dissimilar. If they are very dissimilar, then fusion will be impossible, as we mentioned with the square and with the square and the circle. But if it is slightly dissimilar, this slight dissimilarity can be used from the brain to process the stereoscopic vision. As we mentioned, the tolerated disparity is more in the horizontal than in the vertical plane. Remember the example of the fingers and the face, which has a vertical diplopia. And the tolerated disparity is more when the object is near the edges of the Pannon's area. So more toward the edges, it's more tolerated disparity. So here the right eye and the left eye can see different views for this box. So the right eye will see this slanted view, and the left eye can see this slanted view, and now we can see this box in 3 dimensions. This is because they have different views. Each eye can see a different view of the same box, and since we have 2 eyes, there will be 2 different views. This is the rule, and this is what will cause us to see a binocular vision and with a stereopsis. So stereopsis can have, or depth perception can have some binocular clues, or the being able to see the same object with from both eyes is a clue for having depth perception. But this is this mean that we only need to have 2 eyes in order to perceive depth perception? So we'll mention just that, or we need to know that stereopsis is a very important binocular clue to the depth perception. And stereopsis by its name, or the name stereopsis, cannot occur monocularly, as we don't have any fusion in the Panam's fusional area. We are using only a single eye. So to summarize, that the stereopsis is the perception of the depth produced by binocular retinal disparity. We need to have two different views of the same object to fall on the slightly dissimilar non-corresponding retinal points in order to perceive 2 slightly dissimilar images that the brain will be able to fuse them and see stereopsis. So the 2 objects stimulate the disparate non-corresponding retinal point with the Panam's fusional area. But does this mean, again, I repeat my question, we said this is a stereopsis is an important binocular clue for depth perception. So does this mean that we cannot see any signs of depth perception with only 1 eye? Well, the answer that you can never see stereopsis with 1 eye. But you can see other forms of depth perception with 1 eye. And here is what's called the monoocular clues for depth perception. So depth perception is a wide term or a broad term that implies stereopsis and other forms of depth perception. Stereopsis by its name can't be seen by 1 eye. So you cannot see a 3rd dimension by 1 eye. But other forms of depth perception can be seen with only 1 eye. And this has some clues, or there are some clues that you can use in order to see, to identify the depth perception, like the apparent size, like the interposition, like linear perspective and aerial perspective, lights and shades, and monoocular movement parallax. Let's see what does this mean. The apparent size, if you look at this picture, you can see that this car is large, but this car is small, and this car is smaller. So by just knowing that the car is the larger one is more near and the smaller one is more far, now you know how you have some clue for the depth. You can know even by 1 eye that this car is much more near than the far one because of the relative size between both of them. Another clue is the interposition. If you have 2 objects and one object can clearly hide the edges of the other object, so you can know, or you can see that this blue circle is in front of this red circle. So you can now again appreciate some depth perception even with 1 eye by just knowing the interposition. The interposition meaning that one object is covering the other eye. So the one that covers is the nearer one, and the one that is covered is the far one. Linear perspective, or if you are looking to a parallel lines, the parallel lines will appear to converge at the horizon. So this means that when the lines are parallel, this means that they are near, and when they are converging, this means that they are far. So if there is someone is present here, and someone is present there, you will know that this person is much more near than this person because this person is close to this parallel lines, and they are parallel, so they are close, and they are converging far away, so they are far. So again, you have a clue for depth perception. Aerial perspective, meaning that the dust and vapor and the bluish color in the atmosphere gives an impression that the target is far. So if there is dust and if there is vapor or this bluish discoloration, this means that this more far, or this view is more far than this house, for example, because the particles present in the air, that's why it's called aerial perspective, can make some clue for depth perception. Lights and shades can be also can be given can be a clue for depth perception. So the distribution of the lights and the shades can make an impression that the object is clear or near or far. So the distribution of light here can give you an impression that this circle is more bulging toward you, while the distribution of lights and shades here can give you an impression that this circle is much more away from you. Although this is the same circle of the same size, it is just the difference in distribution of light. Finally, it is called the another monoocular clue. It's called the monoocular movement parallax. So when you are riding a car and this car is moving, your eyes are moving or in the same direction. So here you can see that your eyes are moving to the right as the car is moving to the right, and in this condition, your eyes are following a target, or in the near target, you will find that the near targets are moving in the reverse direction, so it will be the left, while in the far target will be moving to the right. So this is again called the movement parallax. Again, this is very evident when you are riding a train and you are focusing in a point. Then you will find if you are moving from the right to the left, the house and the trees are moving from the right to the left as you are fixing toward them, but the closer objects, closer than the fixation point, like this fence and this grass, will moving in the reverse direction. And this movement parallax is again a monoocular clue for depth perception. So you can perceive even with one eye that this tree and this house is moving in, which are moving with the same direction as you, are far, and this fence, as it is moved in against direction than you, this is near. So these are some clues for depth perception that can be used monoocularly. So how to test for the binocular vision, or how to test for stereopsis? There are some easy tests like the two pencil test. So if we, with one eye, if we approximate the two pencils, we will not be able to put the tip over the tip, because to put the tip over the tip, you need stereopsis, or you need binocular vision. If you have good binocular vision, you can approximate them, but if you covered one eye, you will not be able to do so. But if the patient with two eyes cannot put the tip of the pencil to the other tip, then the patient has a problem with his stereopsis. As you can see here, with both eyes, you can put the both pencils together, but with one eye, this will be difficult. Or if there is a problem with the stereopsis, this will be difficult. Another test that is called the tetanus test. This test depends on polarized glasses. We talked about it before. So the patient wear polarized glasses, and he will be presented this fly. And if the patient has good stereopsis, he will be able to see that the wings of this fly are present in the air. So he may be able, or he may be asked to grasp or to hold the wings of the fly. And if he fails to see the wings are in 3 dimensions, then he has poor stereopsis. And this stereopsis can be graded by these figures and by these shapes, that they will be constructed in different level of stereopsis, so that we can grade the amount of stereopsis that the patient has. Another test called the TNO test. In this test, the patient wear red-green glasses, and he will see the book for this test. He can see some figures like plus, like circle, like triangle, like square. They are embedded in this test and can be only detected by the red-green glasses if he has good binocular vision and has good stereopsis. If there is no stereopsis, he will not be able to find out these hidden figures. The same principle, but without red-green glasses. It is called the Lang test. In the Lang test, the patient is presented this card, and there is some hidden figures present in this card, like this star, like a car, like a cat, and this will be present at different grades of difficulty. So if the patient can see them, then he has good binocular vision and stereopsis. If he cannot perceive them, this test will show the patient stereopsis. And the test that was previously used or historically used, which is a synaptophore, which is dependent on presenting dissimilar images to the both eyes, so it can test for different functions or different grades for the binocular vision. Either the simultaneous macular perception, so it presented similar images but not antagonistic, and ask if the patient can see the animal inside the cage or not, and diffusion by presenting different images which are missing single detail, and ask if the patient can see the full picture of the rabbit with a tail and having a bouquet of flower or not. Stereopsis also can be measured by this device, so we present the same target by different views. So the ball here is on to the left, and the ball here is to the right or above this column, and ask if the patient, where is this ball? Is it in the center? If the patient has good stereopsis, so he can see slanted view of the right and left eye, then he can see that this ball in the center. So this is the end of our lecture. Do you have any question? Is the binocular vision is clear? Or do you have any questions? Okay, so this is the end of our lecture today. So you can see this these photos. These photos are showing that this is a technique of photography called the forced perspective, in which we present images of different sizes, and you can give this funny appearance. And this will be depend on one of the monoocular clues of the perception, which is the relative size. So we know that the cloud is different in the size of this ice cream cup, and the size of the hand is different from these people. So the hand is smaller, so we know that the hand is closer than these people, and also the shoes will be different in size from this person and this person and this person. So this is what we meant by depth perception. You can appreciate that there is something which is near and something which is far, and there are some clues that will give you this impression even with using one eye. Okay, so this is the end of our lecture today. I hope that you are doing well with your study, and because we are going to finish with physiology the next week, and also we are going to do our revision the next week, so I hope that you are ready with this and keeping a good pace with your study till now. Thank you for your attendance and thank you for your attention, and see you.